So we are here with Tereba, the healthcare lead at Jabra. Welcome, Gene.
Thank you, sir. It's a pleasure being with you.
All right, Gene, over the past 2 years, I wanted to ask you, how has selling into healthcare changed from your perspective?
You know, what I've found mostly the biggest thing, and especially in my career, has always been driving urgency, how to really boil things up and get healthcare to get off the dime and actually make purchases. So certainly since COVID, the urgency issue has bubbled up. There's much more of a need to move today than it is to wait and see, that type of thing. So I think that's primarily where it's gone. I think there's also been a validation because of COVID in regards to telehealth and telemedicine and the capabilities and efficiencies there, whether it's patients or caregivers, hospitals, or administrators. Certainly, analytics is really, really big and will be the future in healthcare. And a lot of our Jabra tools have some onboard processing that allows a lot of analytics and, in my opinion, a lot of opportunity, quite frankly. Certainly, I think probably the biggest thing in speaking with my colleagues, both in Jabra as well as folks I've known for decades outside of Jabra, that have sold anything from devices to software to technologies, is they found that it actually kind of shifted from a hunter-gatherer mentality more to a farming mentality, so that there was less discerning effort by the purchasers. They needed to get products, and they needed to do that now. And as a result, there was that shift. I think it's shifting back now to you actually have to earn the business, the trust, and the faith of the customers.
Now, just looking at the healthcare market, I think I know when I show my healthcare space, a lot of people just automatically think hospitals. When you think of healthcare solutions and how Jabra fits, are you thinking primarily of hospitals, or are there other market segments that are important in this space?
Yeah, I think the big flaw is, for my 28 years, it's been in hospitals and health systems at the C level. So that's my first love and passion. Very comfortable there. And I see all kinds of opportunities in a hospital on a departmental level all the way to the whole enterprise structure. And Jabra gear and devices fit perfectly in that space. However, I think there's some real opportunities outside of hospitals, one being home and hospice care. A lot of health systems are developing a separate business entity because of that. And of course, that drives some efficiencies in customer satisfaction as well as penalty reduction. Certainly, telecenters related to healthcare, telehealth, and telemedicine is a big one, especially those centers that are engaged in telemedicine where they need high quality video and high quality audio. One of the other items or areas I think has some tremendous opportunity is healthcare related call centers. Think of that as refer a nurse or refer a doctor, or healthcare coaching, or actually suicide prevention lines. And I'm finding more and more there's a shift from just that needing just that quality audio to actually, it looks like they're moving more and more toward having video. And that's really, really imperative in some disciplines in call center, or some aspects in call center, for instance, suicide prevention. Imagine being able to engage with a person who might be a little concerning, and being able to read them a little bit more effectively. So I think there's some tremendous opportunities out there. And we haven't even talked about like administrative and operational opportunities.
Now, as we were exploring selling into the healthcare space, we kind of broke things down into certain areas, some safety or workflow or mobility. How does Jabra fit into a Jabra solution, maybe best fit into a workflow or a mobility solution within the healthcare company?
Yeah, I think because the quality of the equipment develops a high degree of satisfaction and confidence in the actual task being accomplished. No entity buys a camera or buys a headset or a speaker system to hear or see somebody. They're buying it to treat a condition, to make and basically have positive patient outcomes. So this is just a tool. So having that those type of tools and effective tools really drives a number of issues in a healthcare entity, once again, around hospitals and health systems specifically. For instance, reduction of physician and caregiver burnout. And that's especially prevalent right now. We saw the tremendous shift of nurses going out of the industry because of COVID, because of burnout. So having that capability. Certainly the administrative and the C-level are really, really concerned with their vision, where they're going to go, how everything pulls together, and how, more importantly, how is it going to affect the operational and financial efficiency of the facility? Certainly, resource allocation, whether it be caregivers or whether it be other entities and personnel such as physical therapists, respiratory therapists, being able to have them fill gaps, not just at their hospital, but maybe other hospitals outside of their hospital for outreach and help firming up that outreach. Once again, probably one of the big ones that's a lot of times we always overlook, but is something that almost every hospital, health system, physician group, doctor looks at, is that risk and liability mitigation. How can this help improve that? And by having that background support, whether it be through telehealth, whether it be through excellent devices to help support that, that helps that risk mitigation tremendously.
Terrific. Yeah, certainly the part that screams to me there is just the clinician burnout, right? And the quality of products helping there. So
let me just interject something on that, on
sure.
physician big burnout, because I'm really big on this, mostly because for about the past 13, 14 years, I've been involved with the tele-ICU model. And one of the main reasons that tele-ICU and Jabra gear fits in perfectly for that model is to help prevent physician burnout. Intensivists is the number one, I believe, or number two at the worst, certainly number one. It was the most recent data that I've seen, burnout specialty in the industry. So anything you can do to help provide a better quality of life, better support, not getting those calls at 2:00 in the morning, certainly helps with that satisfaction as well as reduce burnout.
Yeah, I know. I'm a big fan of the microphones on these Blue Parrots. I imagine there's lots of clinical applications for recording voice and good quality and making your life easier for those things, and then the video side as well.
Oh yeah, yeah. Nothing frustrates a physician more than having to re-record something just because of maybe quality of audio. And I believe the Jabra gear is right up there as an industry leader, and we're very, very proud of the quality of our products.
All right, so so our audience here is mostly for our partners, our resellers who sell the products. So now, if they're going into a healthcare space, what do you think would be some of the key questions, or maybe just one key question they could ask that might help open up some opportunities for them?
One key question. That's there's a bunch of different questions, and I'm a firm believer in faces and places. So you don't want to connect with just one person. So you might want to hook up with the chief medical officer, nursing officer, CIO, CMIO, COO, CFO. It all depends, and there's a different story for each of them. So there's a number of different questions that you might have. Primarily, I like to look at get the information on their big vision, whether it's this, whatever their title and the responsibility, whether it's departmental all the way up to the C-suite. Because every purchase that they make has to coincide and align with that vision. So that's, if you were to ask me one question that I would ask anybody in the C-level is, what is your vision? What is keeping you up? What are you going to do to have a competitive advantage versus competitive necessity in the next 2 years? Because status quo is not a strategy. You have to prepare. We found how flat-footed we were with COVID. Even though we knew that were going to be things occurring in the future, but very few entities had a real vision on how to address those things. And unfortunately, we'll have another, maybe not COVID, but another pandemic at some point in the future.
Gene, do you have a favorite use case that you've seen leveraging Jabra solutions?
Yeah, my favorite all around is the Telesitter model. I don't know if you're familiar with that. In a lot of cases, a nurse would have to watch a patient because of falls prevention maybe, or some kind of risk. Historically, without a Telesitter model, you'd have one one staff member watching a gene in the bed or watching a gene under the circumstances to help prevent those never events. With a telesitter, you literally could have the Brady Bunch view with the cameras and the audio systems, and Gene could be watching 20 different mics at 20 different locations. So it's very, very cost effective. It's very, very big. There's a big movement for that. Certainly, I think other use cases that are some tremendous values. We've talked about hospice and home care. And you mentioned Blue Parrot. Blue Parrot's perfect for that. And I think those are two of the three use cases that we're concentrating on for the next couple of years, or at least certainly the next year.
Absolutely. So the telesitter one, just describe, so would a Panacast be a key piece to that, and the wide angle, just seeing a full room from one spot?
The Panacast is, I think, a perfect solution for that because once again, you can structure that angle, whether it be just a bed to watch Gene falling or whether it be the whole room. So for instance, another never event that occurs is bed sores, discus ulcers. And how you prevent that is basically a nurse comes in to turn a patient, to turn Gene because he's at risk every X amount of hours, whatever the protocols are for that particular entity. With Panacast itself, we mentioned that AI and some of the side capabilities, we can measure or watch and acknowledge that maybe nobody has been in within that time frame and just say, hey, somebody needs to go in and turn Gene just to reduce that issue. Remember, such never events as falls and bed ulcers are items that hospitals get penalized on financially, as well as for their health grades, which is something that all of us as consumers generally should be looking at before we go into any hospital or doctors or dentists.
If I can just follow up on the intelligence question, right? So leveraging either the analytics or the AI inside of the solutions, right? So, is that a focus at Jabra to continue to provide, like, what's the key piece of the intelligence? Is it helping people make better decisions? Is it just enabling something operationally?
I think it's operational efficiencies, quite frankly. And this is actually one of my, not bugaboos, but my passions, because I see a lot of investment being made in AI capabilities. As one of my colleagues lovingly says, the ones and zeros are being done right now on the cameras, whether it be the 20, the Panacast, or the 50. And it's just really massaging those ones and zeros, so to speak, to capture some of the information that they might be able to need or utilize. So for instance, we've talked about Panacast, but Panacast 50 certainly has some capabilities in regards to some of those tools with the onboard processing and potential artificial intelligence, and really what you can do with it in the future. I think we're at the very beginning stages of looking at the potential of it, but such things as like participant count allows us to look at certain components of what's happening in an engagement with a number of people. But how we actually use that information, or how a software partner might use that information, can have some real potential and opportunities. Once again, I found that hospitals and health systems will invest a lot of money just in the hopes and dreams and possibilities of AI, and not necessarily in the reality of it today, quite frankly, because we're once again at the very beginning of AI. Interestingly, I was at HIMSS a couple of weeks ago. I'm going to be at AT&T, or ATA, which is the American Telemedicine Association conference, in a couple of weeks. And I've seen tons and tons and tons of people like I've never seen before touting and talking about AI. And the more important side is where I've been in working with hospitals and health systems the past few years, certainly the past 6 or 7, as I've been on the catching side, so to speak, the hospital side, to see how the buying process, AI really is becoming one of those. We talk about visions for the future and that capabilities. Once again, that we're not there right yet. We have the capabilities. It's really working with partners with what they want to do. So we're working with some companies and health systems in the West Coast that want to exploit some of those ones and zeros again.
I brought with me two of my favorites, right? My go-tos, and I work in the demonstration center here at Ingram, so I have the freedom of testing a lot of different headsets. So my go-to work headset is a Blue Parrot, 350, as I move around a lot, and the noise canceling. I actually work in a data center. It's fantastic, and then when I'm around people and I don't want to hear them, and I go with the two-ear and I use the Evolve on that. What is your go-to headset?
I do have a 65 that I love when I do use a headset, because periodically somebody will be cutting down trees in the mountains here. But my go-to is the 750. I love this bad boy. Great quality.
All right, Gene, thank you for your time. I appreciate it. I know you're a busy man. Thank you very much.
Hey, Mike, I appreciate your time. This has been a real pleasure. I hope I've given you some insight on what we think. Certainly my passion for Jabra, and certainly my passion for telehealth and telemedicine, as well as healthcare in general.